In the summer of 1945, as the final tremors of World War II shook the Pacific, a small group of Japanese women huddled together in the belly of an American transport ship. Their white nurse uniforms, once pristine symbols of healing, were now stained with the grime of defeat and the terror of the unknown. These women had dedicated their lives to saving others. They had worked 18-hour shifts in field hospitals, tending to wounded soldiers with supplies so scarce they often had to choose who would live and who would die. They had been told again and again that capture by the Americans meant something worse than death. But as the ship cut through the Pacific waters toward an uncertain fate, none of them could have imagined what awaited them. For these Japanese nurses were about to encounter something that would shatter not just their expectations of American cruelty, but their entire understanding of what it meant to be human in wartime. Their names were Sakura, Emiko, and Yuki. Their story is one of the most extraordinary and untold chapters of World War II, a story of how real medicine, genuine care, and unexpected compassion became the most powerful weapons in breaking down the walls of propaganda and hatred. Sakura Tanaka was 23 years old when she volunteered for the Japanese Red Cross nursing service in 1943. Born in a small village outside Hiroshima, she had dreamed of becoming a teacher until the war changed everything. The call for nurses was desperate. The empire needed every capable woman to serve. The training was brutal. From dawn until midnight, the young women learned not just medical procedures, but unwavering loyalty to the emperor. They memorized the soldier's creed, death before dishonor. They were taught that American soldiers were savages who would torture and defile captured Japanese women. These lessons were drilled into them with the same intensity as learning to suture wounds or set broken bones. Emiko Yamamoto, 2 years younger than Sakura, came from Tokyo. Her father was a doctor who had initially opposed her joining the military nursing corps. "War is no place for a gentle soul like yours," he had said. But by 1944, gentleness was a luxury Japan could no longer afford. Every available person was needed for the final defense of the homeland. Yuki Sato was the youngest at 19, barely finished with her basic nursing training when she was assigned to a field hospital in the Philippines. She had never been away from her family's farm in northern Honshu. The first time she saw a man die, she vomited for hours. By her 10th death, she no longer flinched. By her 100th, she had learned to close her heart to protect her sanity. These 3 women, like thousands of others, became part of Japan's desperate final effort. They worked with medical supplies so limited that they reused bandages after washing them in polluted water. They performed surgery by candlelight when the generators failed. They watched young soldiers die not from their wounds, but from infections that proper antibiotics could have prevented. But most importantly, they had been conditioned to believe that capture by Americans meant a fate worse than death itself. The end came suddenly. On August 15th, 1945, Emperor Hirohito's voice crackled over the radio, announcing Japan's surrender. The women barely understood the formal language, but the weeping of their commanding officers made the message clear. The war was over. They had lost. Sakura remembered the silence that followed, not the absence of sound, but the presence of a crushing, suffocating quiet that seemed to swallow hope itself. Around them, soldiers began destroying medical records, burning uniforms, and preparing for what they believed would be their final moments of honor. Some chose suicide rather than face capture. Sakura watched a senior nurse, a woman who had taught her how to set broken bones, walk calmly into the ocean, and never return. Others gathered in small groups, sharing stories of home one last time, preparing for the brutality they were certain would come. But when the American soldiers arrived, something unexpected happened. They came with their weapons lowered. They spoke in calm voices, They offered water to the thirsty and medical attention to the wounded. Sakura watched in confusion as an American medic gently bandaged the arm of a Japanese soldier who had been injured trying to destroy equipment. The American commanding officer, a tall man with kind eyes whose name was Colonel James Morrison, addressed the group through a Japanese-American interpreter. "You are now prisoners of war," he said, "but you are also human beings, and you will be treated as such. Any nurse who wishes to continue providing medical care will be given the opportunity to do so." Emiko later wrote in her diary, which she somehow managed to keep throughout her captivity, "I waited for the cruelty to begin. I waited for the humiliation, the violence, the degradation we had been promised. Instead, I was given a clean blanket and a bowl of hot soup. I did not understand what kind of trap this was." The transport ship, USS General Walker, had been converted to carry prisoners of war. The 3 nurses, along with 47 other Japanese women, mostly medical personnel and military communications workers, found themselves in quarters that defied every expectation they had harbored. They had expected to be chained in the ship's hold, fed scraps, and treated like animals. Instead, they were assigned to clean bunks with actual mattresses. They were given 3 meals a day, more food than many of them had seen in months. There was fresh water for washing, and medical attention for anyone who needed it. Yuki, the youngest, was suffering from a persistent cough that had plagued her for weeks in the Philippines. During their second day at sea, an American Navy corpsman named Thomas Bradley approached her with a stethoscope. Through the interpreter, he explained that he wanted to examine her lungs. She recoiled at first, terrified that this was the beginning of the torture she had been warned about. But Sakura, seeing the genuine concern in the young medic's eyes, convinced Yuki to allow the examination. What happened next would remain etched in all their memories forever. Corpsman Bradley diagnosed Yuki with early-stage pneumonia. Without hesitation, he administered a shot of penicillin. Real penicillin, not the rice water substitutes they had been using in Japan's depleted medical facilities. Within days, Yuki's cough began to clear. She was given antibiotics to continue the treatment, along with vitamins to address the malnutrition that was evident in all the prisoners. It was medicine that could have saved dozens of their patients back in Japan. Medicine they had only dreamed of having, and it was being given freely to their enemy prisoners by the very people they had been taught to hate. During the 3-week voyage, something remarkable began to happen. The American medical staff started asking the Japanese nurses for their expertise. They wanted to learn about traditional Japanese herbal remedies. They were curious about techniques for treating wounds with limited supplies. They shared their own knowledge freely, demonstrating new surgical procedures and modern pharmaceutical treatments. Emiko found herself working alongside Lieutenant Mary Catherine O'Brien, a Navy nurse from Boston who had served in the Pacific Theater for 2 years. Despite the language barrier, they developed a professional respect for each other's skills. O'Brien taught Emiko about the proper use of sulfa drugs. In return, Emiko showed O'Brien traditional Japanese methods for managing pain without morphine. When the ship docked at San Francisco Bay on September 18, 1945, the 3 nurses stood at the rail, staring at a sight that challenged everything they thought they knew about America. The city was intact. There were no bomb craters, no destroyed buildings, no signs of the devastation that had consumed Japan. They were transported to a prisoner of war camp in Colorado, a facility that had previously housed German and Italian prisoners. The camp was surrounded by barbed wire and guard towers, confirming their expectations of prison life. But once inside, their preconceptions were again shattered. The camp had a fully equipped medical facility, not a field hospital with makeshift equipment, but a genuine medical center with X-ray machines, a well-stocked pharmacy, and operating rooms that were cleaner than most hospitals in wartime Japan. The camp's chief medical officer, Dr. Robert Harrison, was a veteran of the European theater who had volunteered to work with prisoners of war. Dr. Harrison made an announcement that left the Japanese nurses speechless. He invited any qualified medical personnel to join his staff. They would work alongside American medical personnel, treating not just prisoners, but also local civilians when needed. They would have access to real medical supplies, proper equipment, and ongoing medical education. Sakura was the first to volunteer. Her first day in the camp's medical facility was like stepping into a dream she had never dared to have. The pharmacy was stocked with medications she had only read about in medical journals: morphine, penicillin, insulin, sulfa drugs, surgical anesthetics. There were sterile surgical instruments, clean bandages, and antiseptics that weren't makeshift substitutes. Her first patient was an elderly German prisoner named Klaus Weber, who was suffering from diabetes. In Japan, Weber would have died within weeks. Here, Sakura was able to administer proper insulin treatments, monitor his blood sugar levels with actual testing equipment, and provide a diet that helped manage his condition. "I saved a man's life," she wrote in a letter to her sister that was never sent. "I saved a life with real medicine, real tools, real hope. How is it possible that our enemies have given me the power to heal that our own country could not provide?" Emiko was assigned to work in the camp's surgical unit. Her first operation was assisting Dr. Harrison in removing an appendix from a young American guard who had become ill. She expected to be treated as an inferior, a prisoner performing menial tasks. Instead, Dr. Harrison treated her as a colleague. He explained each step of the procedure, asked for her opinions on patient care, and even complimented her surgical technique. The surgery was performed with proper anesthesia, sterile conditions, and post-operative care that included antibiotics to prevent infection. Every aspect of the procedure was better equipped and more professional than anything she had experienced in Japan's military hospitals, where surgeries were often performed without adequate pain relief and with reused, barely sterilized instruments. Yuki, meanwhile, was assigned to the camp's general medical ward. Her patients included American soldiers being treated for various ailments, German prisoners with chronic conditions, and even some Italian prisoners who had been transferred from another facility. She found herself providing compassionate care to the very enemies she had been trained to hate. As weeks turned into months, the three nurses found themselves caught in an impossible psychological position. Everything they had been taught about Americans, that they were savage, cruel, and inhumane, was being contradicted by their daily experiences. Sakura struggled with what she later described as the cruelty of kindness. The Americans weren't just treating them humanely, they were treating them as professionals, as equals, as human beings worthy of respect. This kindness was harder to bear than cruelty would have been, because it forced her to question not just her enemies, but her own government's truthfulness. One evening, while organizing the pharmacy's inventory, Sakura realized that this single prison camp had more medical supplies than the entire hospital where she had worked in Japan. The abundance was staggering. Not just basic supplies, but advanced medications, modern equipment, and educational resources that allowed her to learn new techniques. Emiko faced her crisis during a conversation with Dr. Harrison about her medical training. When she described the conditions in Japanese military hospitals, the lack of supplies, the impossible choices, the preventable deaths, she saw genuine sadness in his eyes. He wasn't gloating about Japanese suffering. He was genuinely grieved by it. No medical professional should have to make those choices, he told her through the interpreter. Medicine is about saving lives, not choosing who deserves to live. What you experienced wasn't your failure. It was a failure of resources and priorities. That night, Emiko wrote in her diary, "If our enemies have more compassion for our suffering than our own leaders who created that suffering, then what does that make us? What does that make our war? What does that make our sacrifice? Yuki's transformation came through her patience. She grew particularly close to a young American soldier named David Patterson, who was being treated for a severe leg injury sustained during training. Patterson was only 20 years old, barely older than herself, and far from home. As she changed his bandages and administered his medications, they began to communicate through gestures, simple words, and eventually broken conversations in each other's languages. Patterson told her about his home in Kansas, about his family's farm, about his younger sister who wanted to become a nurse. His stories weren't about conquest or cruelty, but about ordinary dreams and simple hopes. He spoke about his fear of the war, his homesickness, and his gratitude for her care. He was, she realized, exactly like the young Japanese soldiers she had treated, scared, hurt, and longing for home. The realization that her savage enemy was fundamentally no different from her own countrymen created a psychological earthquake that shook the foundations of everything she had believed about the war, about nationality, and about what it meant to be human. By the spring of 1946, the three nurses had become integral members of the camp's medical staff. They had been given responsibilities that went far beyond what they could have imagined. Sakura was training other prisoners in basic medical care. Emiko was assisting in complex surgeries. Yuki had become the primary care provider for the camp's elderly prisoners. But their most profound transformation wasn't professional. It was personal. They had discovered that the greatest medicine they had received wasn't penicillin or sulfa drugs, but respect, dignity, and the opportunity to practice their calling without the artificial limitations of nationalism and propaganda. The war had ended, but their captivity continued until proper repatriation arrangements could be made. However, when the time came for them to return to Japan, all three nurses faced an unexpected dilemma. They had grown attached to their work, their patients, and their American colleagues. More troubling, they had grown afraid of returning to a country that now seemed foreign to them. Japan in 1946 was a nation in ruins, struggling with defeat, occupation, and the collapse of everything it had believed about itself. The three nurses had spent months in an environment where their skills were valued, their opinions respected, and their humanity acknowledged. The thought of returning to a society that might view them as tainted by their contact with the enemy was terrifying. Dr. Harrison made an unprecedented offer. He recommended all three nurses for immigration visas to the United States. He had contacts at American hospitals that were eager to hire qualified medical personnel. They could continue their careers in a country that had the resources to support their calling. It was an offer that would have been unthinkable at the beginning of their captivity. The opportunity to join the society of their former enemies permanently. Sakura chose to return to Japan, but not unchanged. She carried with her detailed notes about American medical techniques, pharmacy management, and patient care protocols. She was determined to help rebuild Japan's medical system using the best practices she had learned from her captors. Emiko decided to stay in America. She eventually became a naturalized citizen and spent 37 years working as a surgical nurse in Denver, Colorado. She never forgot her origins, but she had found a home in the country that had shown her what medicine could be when resources and humanity were combined. Yuki made the most complex choice of all. She returned to Japan for 2 years to care for her aging parents, then immigrated to America in 1948. She worked as a translator and cultural liaison for the American Red Cross, helping to establish medical exchange programs between the two former enemy nations. The story of these three Japanese nurses is more than just a tale of war and captivity. It's a testament to the transformative power of treating people with dignity, even in the midst of conflict. Their American captors could have provided minimal care, basic food, and adequate shelter, the bare requirements of the Geneva Convention. Instead, they chose to provide something far more powerful: the opportunity for professional growth, mutual respect, and shared humanity. The real medicine that healed these women wasn't found in bottles or surgical instruments. It was found in the radical act of treating former enemies as human beings worthy of respect, capable of contribution, and deserving of the same professional opportunities that would be given to anyone else. Decades later, when asked about their experience, all three women gave remarkably similar answers. They didn't remember their captivity as a time of imprisonment, but as a time of liberation. Liberation from the limitations of nationalism, from the artificial barriers of propaganda, and from the tragic waste of human potential that war creates. Their story reminds us that even in humanity's darkest moments, the choice to extend compassion, respect, and dignity can create ripple effects that last for generations. The American medical personnel who chose to treat these prisoners as colleagues rather than enemies didn't just provide better medical care. They demonstrated a different way of being human in a world torn apart by conflict. In a war defined by unprecedented cruelty and dehumanization, 3 Japanese nurses discovered that the most powerful weapon against hatred isn't superior firepower or better tactics. It's the simple, radical act of treating your enemies as human beings. And sometimes, that act of humanity can transform enemies into healers, prisoners into colleagues, and a prison camp into a place where the true medicine of understanding can finally begin to work.